Hello, friends, and welcome back to Autoimmune Adventures, where we explore real life living with autoimmune disease or chronic illness and how to build a life that is still meaningful and joyful and full of possibility. I'm Alicia, and I am joined with my sisters, Stacy and Becky, along with our guest, Dr. Jess Armine. We're really excited to have him on. He is a man that brings clarity and hope to one of the most confusing health challenges that people are facing right now, long COVID, and complex chronic illnesses as well. For nearly 5 decades, our guest has worked with patients who had seen multiple doctors and still had no answers. And then when long COVID began emerging, he immediately recognized patterns that many others were missing. Things like mitochondrial dysfunction, immune dysregulation, oxidative stress, and nervous system overload. What makes his approach so powerful is that he looks at the whole system, not just isolated symptoms, and helps people understand what's actually happening in their bodies. We are so honored to welcome our guest, Dr. Jess Armine. Dr. Jess, thank you so much for being here with us today.
Thank you for having me. I really appreciate this opportunity.
All right. So many of our listeners live with autoimmune disease or other chronic conditions. From your perspective, what exactly is long COVID? Because I think a lot of people don't necessarily understand what it is. And what is happening in the body at the cellular level?
Well, let's go and talk about even autoimmune problems. The way that they're handled today is you get diagnosed by a series of symptoms and maybe some lab results. And it's treated on a symptomatic basis because the premise is you have it, it's never going to go away, it's going to follow a certain course, and we're going to manage it. Now, that's true with all chronic illnesses, diabetes. We'll talk long COVID just as a referent. But we have a tendency, because we've been trained this way, to look at the various labels, if you will, okay? Rheumatoid arthritis, Sjogren's, dysautonomias, diabetes, and Hashimoto's thyroiditis, and anything that's a chronic, ongoing illness, and we're given the impression that it's permanent, which means there's nothing you can do about it. And by the way, it stinks to be you, and it's just a roll of the cosmic dice. Okay? In my time in healthcare, which I was started as a paramedic and then a registered nurse, and then I became a doctor, I noticed some patterns that this was a reality, that people were told, hey, you got this. Okay, then they would read about it. They would go on the internet, Dr. Google, my worst enemy, and they would say, oh, well, this is what's going to happen, and I'm just better resign myself to it, and let me take those biologics if the steroids don't work, and I can't take that long term, and the NSAIDs tear my stomach up, and maybe COX-2 inhibitors do the same thing, so now I go to the biologics, and you see them on TV, and everybody's dancing around, but if you close your eyes, you hear that, oh, this thing can destroy your immune system, you can get horrible infections, people have died in the trials. I'm like, really? Okay. But what it's doing is dampening, not supporting your immune system, but dampening it down. So what's happening here? Okay. At the cellular level, before I get into that, whatever damage happens at the cellular level from the root causes engenders by several mechanisms, but one main mechanism, chronic inflammation. What does chronic inflammation do? Well, we all talk about genetics, right? Well, I'm also a genetic expert, and genetics are not your destiny. You were born with those genetic pathways that you might want to call them polymorphic or SNPs or whatever, but without getting into big terms, I always tell my patients, if I say a big word, ignore it, okay? Because I'm going to explain in the next 10 seconds. Mm-hmm. You're not going to be impressed that I can pronounce polysyllabic terms and I know all the pathways. What you'll hopefully be impressed is I can tell you how they work. When you were a baby, it wasn't a problem. Still had those genes. They were the same. Okay, those are the genes. Okay, what makes the genetic predispositions express? Chronic inflammation, oxidative stress, same terms. Okay, chronic inflammation / oxidative stress, / ROSs and RUSs and RNSs and stuff like that, create difficulties in the pathways, and they allow certain problems to express. And what you see are most diseases that we call, autoimmune disease, whatever they happen to be, are created from chronic ongoing inflammation. What causes that? Toxins. There was a study done called the cell danger response by Robert Navio, who's an MD PhD, in 2013. It's a bit on the complex side, but here's the basis of it. He identified something called the cell danger response. This is what your cells do when something attacks. Okay? There's a series of events which I'll explain in a moment. The things that create this process are toxins, as you might expect, mercury, all kinds of different things. We live in a toxic society, let's face it. Okay? Microbes, bacteria, viruses, so on and so forth. And all the psychological, emotional, and spiritual traumas that we face. He proved on a scientific basis that what most people say, oh, it's in your head, are actually creating cellular damage. Subsequent studies have shown that things like depression and anger and so forth, and this is a loop, but they actually support the creation of inflammation, which is in scientific terms called pro-inflammatory cytokines. Okay? So it actually happens, and in this time frame, one of the major damages to the cell is the spike protein from COVID. Now, the spike protein is a toxin, and it sits in your receptors and it interferes with things like mitochondrial function, but they can be a cellular dysfunction, okay? Something that contributes to this chronic inflammation, because that's the result of it, okay? And the spike protein from the vaccines is much more powerful, and if you will, worse, than the spike protein from the virus. How do we get that? Well, you get it from getting the virus, you get it from getting the vaccines, and from shedding. Okay? And people are still exposed to COVID.
I find this fascinating because what I think that people don't always understand, I'm very pro-vaccine. However, when I had the COVID vaccine, it caused all kinds of autonomic problems for me.
Oh, yeah.
It messed me up. Now, it kept me, when I got COVID, it kept me from getting put in the hospital, right?
Right.
But I was still dealing with all these side effects.
Exactly.
And now that I hear what you're talking about with that stronger spike protein, that makes sense to me that my body, which was already challenged by autoimmune disease and was already in a state of inflammation, would then in turn be even more revved up, and that would cause me all these side effects.
There's a lot of politics involved here between the mRNA vaccines and the whole virus vaccines, which we could talk about for about 3 hours. Okay, there's a reason why the whole virus vaccines, like the Sputnik and the Johnson & Johnson, were pushed to the side from exaggerated evidence that really didn't exist. Nevertheless, that type of vaccine tends to look at the entire genome of a virus. That's why when you get this flu vaccine this year, okay? It doesn't protect you from this year's flu, because that's a last year's flu that has mutated. That's normal. Viruses mutate, and they don't mutate to worse forms because they don't want to kill the host. Who would want to do that? Okay, they're not that stupid. Okay, but when you have the whole genome you're looking at, you say, listen, if I see you, I'm going to kill you. But if I see your brother, sister, your aunt, your uncle, or your first cousins, I'm going to get them too because I recognize you. And that's the basis of the benefit of those vaccines. When you use a vaccine that only looks at a little part of the genome, then I say, okay, if I see that, I'm going to kill. But if I see the variants, if I see the brother, sister, first cousins, the mother, the father, okay, I'm not going to recognize. So we're going to need more vaccines. So that's when they went crazy with the variants. Oh, this Lambda variant. Blah, blah. Guess what? When the public around the world got tired of the catastrophic, then all of a sudden they stopped and said, we're not going to do this anymore. And boom, that's when all the studies which were previously done came out about the side effects. Okay? How do you know if this is an issue? Because the testing out there stinks. Okay? It's really simple. I learned how to be a doctor from very old times. I do everything by history. In other words, I take an hour and a half to take somebody's history. That's how I figure out what's wrong for those people. who haven't been able to find out what's wrong. I usually just ask and listen a lot, okay? And I joke around a lot because I believe that disease is a bully, okay? And the way to get rid of a bully is to punch it in the nose or laugh at it. You take away its power. Okay? That's why I'm so jovial. I always tell my patients, I have so much experience. If I look nervous about something, you should jump out the window. Okay, okay. You know, it takes there's very little I haven't seen. Okay, but it's important that if you want to know how if you have a problem with the spike protein, it's very, very simple. If you were ill before the pandemic and you became more ill and you never returned to baseline, the spike protein, long COVID, is what's causing it. Simple logic. If you were healthy and you became ill and you never returned to baseline, in other words, your energy isn't as bad, isn't as good, you didn't recover from exercise that well, and you're just not yourself. And maybe you were blaming it on aging, maybe you were blaming it on something else. But if you look back at how you were before the pandemic and how you were after, and I won't move back and forth because I wasn't like that, okay, then you can reasonably say that's the spike protein. Long COVID simply means those symptoms that haven't gone back to baseline continue. And they will worsen over time because that's another reason for cell danger response. Now, what happens in the cell when it's attacked? It's very simple. Not really simple, it's actually complex, but very simply, what happens is the cell system says, I don't like this. So it closes off the borders so it can't escape. Then it makes the inside of the cell inhospitable. Acidity, toxicity, it increases the oxidative stress in the cell. But you can think about it as being, it makes the environment inhospitable for whatever's there, okay? In the process of doing that, it messes with methylation. It doesn't allow uptake of vitamins. It holds on to heavy metals, okay? But it's a short-term thing. So after whatever attack is dead, we have mechanisms that return the cell to its normal function. I call it rebooting. Okay? Give you an example that's real easy. Everybody's had an infection, let's say strep throat. Feel terrible. The doctor gives you some antibiotics. Over a few days, you start feeling a bit better. But there's that day where you turn the corner. You get better rapidly. That's when the cell danger response has reversed itself and normal physiology happens. But when you have multiple or ongoing attacks to the cell, that cell danger response doesn't reboot. You start getting a buildup of heavy metals. You start getting difficulty in the internal functioning of the cell. And if your cells don't work, you're not going to work. So what happens when you put cells together? You put tissues. Put tissues together, you have an organ. You have organs. Put a bunch of organs together, you have a body. So if you look at this from the inside out, and you start thinking about the parameters of the cell danger response, which result in chronic inflammation, now you have a target you can treat. For most people, whatever the expression happens to be, autoimmune diseases, long COVID, and so forth, are simply lists of symptoms. Why do I make such a point about this? You know, I've been doing this a real long time, okay? And one of my subspecialties is the natural treatment of neuropsychiatric problems, but it's related, okay? And unfortunately, if you have schizophrenia, if you have whatever, and you're being told that that's your lot in life, and you have to take these medicines for forever, you accept that. You don't have control over it. If I look at you and say, you know, we can fix your basic function, I call it foundational treatment. You'll see it as terrain treatment or bioterrain treatment. But guess what? I'm the guy who invented it. I was beating my colleagues up for years, and they were laughing at me. Now all of a sudden they're preaching it like it was their idea, which is fine. I don't care. There's no Armine method out there. I don't have an ego like that. I just simply wanted to get the information out. Now my colleagues are beginning to treat like that. Okay? So if we fix your ability to heal and get rid of the root causes, okay, you can start to heal. What is the common thing that's done today? Let's treat the root causes and the body will take care of itself. Well, in an acute condition, that works, but not in a chronic condition because the damage has already occurred. And you have to give the body what it needs to repair the damage. Okay, and start listening real good because sometimes the root causes are not attended to because they don't believe that those root causes will cause long-term effects, just like the spike protein. Lyme disease, it's only now in this time frame that they say chronic Lyme exists. If you go to the infectious disease doctor, they'll look at you and say, chronic Lyme doesn't exist. I'm like, are you telling me that the Lyme organism is the only microorganism on the planet that can only give you an acute condition and not a chronic condition? I felt like Darth Vader. I had this guy up against the wall, up and saying, well, I find your lack of diagnosis disturbing. You know, come on, it doesn't make sense. All right? It's true. And I know I'm jovial about it. And the reason I do this, I sincerely want you to everybody to get this point. Okay? Because frankly, if you don't believe that something happens, if in Australia Lyme doesn't exist, it's because they don't allow the diagnosis. It's not only now, before they didn't allow, well, we don't have it. Why? They would, for whatever reasons, which I won't get into, when they would rather take care of the long-term effects than treat the cause. And they know that even if you eradicate the cause later on, when those downstream effects are there, you'll still have those downstream effects because that's body dysfunction.
I agree with that.
Right. Why?
I was going to say, I know somebody personally who has long-term Lyme, and he's fought it for years, and it's, you know, it's a real thing. I have loved how you've been kind of unpacking the quote-unquote mystery of long COVID, because I think a lot of us have heard the term and maybe we're not. I know I myself, because I have a couple people I know that have been diagnosed with it, but I have also wondered what all does that entail. So I think you did a nice job helping us understand that. Kind of along the same lines, though, we have a lot of people we've seen, not just people who started having like autoimmune symptoms and stuff after they had COVID, but a lot of people who, like Stacy herself was saying, had autoimmune diseases already, got COVID and found that it like impacted their autoimmune, made their symptoms even worse. Is that kind of along the same lines, or do you want to?
No,
well, I'm sorry, but I should add something important here because this does matter, and I'd love Dr. Jess's take on this. It wasn't so much that it affected my autoimmune disease, it affected my autonomic system.
Yeah.
So my breathing became complicated. My heart freaked out.
Right.
Like the systems that we automatically have. You don't normally have to think about breathing. You don't normally have to think about, is my heart beating the way it should? And that's what it messed up. And I was told by my doctor that it was probably because I had all this chronic inflammation as an autoimmune person. And I was like, I don't know. It never sat well with me. So I would love your take on that.
Well, believe it or not, you're getting to a very great point. Let's talk leaky gut syndrome just as an example. Okay, one of the major creators and continuers, if you will, of chronic inflammation is leaky gut syndrome, because antigens get through the gut, it's worked on by the immune system, and you start building a lot of antibodies and yada yada yada. But what you normally see first are food intolerances. Okay, and as that progresses is when you start getting more immune abnormalities, leading to autoimmunity. Okay, however that expresses, neural autoimmunity and so forth. But when it gets really bad, that's where you get dysautonomia, which is what you just explained. Dysfunction of the autonomic or automatic nervous system. That can express by POTS, postural orthostatic tachycardia syndrome. Let's say cardiac things. I've seen people who've come off drugs and they have, the temperature dysfunction. It's hot over here, and then their hair standing up on their arms, okay, because they can't temperature regulate. Okay, they can't regulate their blood pressure, and guess what? That's an extension of chronic inflammation. So if you have autoimmunity, which means you got to turn up chronic inflammation, okay, adding to that, guess what? Okay, you're going to get autonomic nervous system or further neurological expressions, okay. The problem is, okay, so here's what happened with your COVID shot. You got the immunization. It messed with the nervous system and gave you more inflammation. But when you got COVID, it recognized the COVID organism, or at least most of it, and kept that under control, which is what it's supposed to do. But it didn't have, does it have to be that way? Do you have to get all these other symptoms? Okay. It's just showing you it's increasing inflammation, but yet it didn't recognize the COVID organism. Okay. When it continues, when those symptoms that you have continue, let's say your dysautonomia continues, okay, and that's something that we have to start reversing. Okay. That body balance function is called homeostasis. Okay. Think of it as a bell curve. All right. If the mean or the middle of it, if you go about a couple of standard deviations out, your body will take care of it. It's called homeostatic mechanisms or allostatic mechanisms. It's like a buffer in a fish tank. Okay. Like a little acidic goes a little alkaline, it balances it. But most people with autoimmune diseases are like 35 standard deviations out. As a practitioner, what we need to do is kind of march them back to that 1 or 2 standard deviations so their body takes over. Okay, you don't need me for forever. My job is to get your body back to where it functions on its own. Sadly, in alternative and traditional medicine, we have specialists. And specialists, specialists are very good at what they do. Very good. Except when all you have is a hammer, everything looks like a nail. Lyme specialist, everything's Lyme. IBS specialist, everything's irritable bowel syndrome. By the way, chronic diseases all have kind of the same symptoms. Okay, that's what it is. That's why I worked backwards and found the chronic inflammation link. Okay, the oxidative stress link. So, if we start marching you back by giving your cells back the ability, reversing the cell danger response, reversing the lack of neurotransmitters, let's say, because the reason that they're down is because all the storage areas have been exhausted. And of course, if your gut doesn't work, you're not going to produce your serotonin because 80% of serotonin is created in the gut. And I can really go, way off and point out different things. But the bottom line is, if we start giving your body what it needs to work, and this is recognized on taking a history, there are lots of tests you can do, but practitioners should not make the test to create the diagnosis. Okay, what the test should do is confirm or deny certain things, okay, or give you targets. If I do an organic acid test on somebody, now I'm looking at if they have fungi, if they have bacteria, if they have Clostridia. I'm looking at the entire energy pathway, glycolysis, Krebs, and yada, 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 and mitochondria. I'm looking at, various parameters that I can sit there and go, whack. My youngest son, has been exhausted. And of course, I'm dad. Why should he listen to me, right? Because if he asks me something, I'm going to start the Big Bang, right? It's a dad's job to make something confusing. It's revenge, actually. So I did an organic acid test on him, and a lot of things were perfect except his energy pathway, which is glycolysis into something called a Krebs cycle and beyond that, okay? Without getting into that explanation. All the parameters there were bottomed out. I sat there and I said, I knew you had energy problems. I know you have a lot of inflammation, a lot of stress in your life. Now I've got a target. Now I know exactly what I want to do, aside from the foundational treatment, to get that pathway shored up. He needs the cofactors and coenzymes, all these different things. It isn't difficult to do once you see it, okay? I can do it empirically, okay? But by doing the test, only gave me a more specific target, okay? Shouldn't let the test be my diagnosis for me. And that's the usual issue that I'm seeing in most practitioners. And specialties do not look at the whole person, sadly.
No.
In this time frame, I remember when I'm 69 years old today. I remember as a kid, my family doctor, my GP, Dr. Siegel, he knew everything. Okay. And of course, he knew me since I was born. But if he sent you to a specialist, the specialist would barely talk to you and say, I'll call your doctor. Why? Because your doctor, he will call your doctor, explain to him what was going on, and then your doctor will tell you what he thought. What he thought. That guy's nonsense. Or that guy, yeah, he's exactly this is what we should do. And you listen to your GP because he's the one that we should advocate. He's the one that would make sure you got care. Not that anymore. Family medicine was an afterthought in the whole specialty thing. I was around in the 1970s. I saw the changeover. Okay, GPs are ostracized. You can't call yourself a generalist anymore. It's to laugh at you. Okay?
That's tragic, actually, because we had some fantastic family practice doctors growing up as well. And you really don't see those doctors very often anymore. And as you were talking about with all of the specialists, they're each treating a different system in your body, not looking at your body as a whole. And that is why we have our goal of opening an autoimmune hospital or center where all of those doctors can convene together to talk about a single patient at a time, because we are a whole. Our body is a whole, and it is important to look at all those things at once.
Okay, so one of the concepts you talk about a lot is mitochondrial dysfunction.
Mm-hmm.
And for listeners who might not be familiar with that, why is energy production so central to chronic illness?
Because energy production is, which is your ATP, adenosine triphosphate. The production of ATP is how your cells work. That's the energy source. Okay. And you go into the mitochondria. Well, there's lots of things that will block the entry into the mitochondria. Okay. One of the major ones is when glutathione, your master antioxidant, breaks down, becomes oxidized. Okay. God gave us a mechanism that recycles it back to the active form. If that recycling mechanism is not working for various reasons, usually a lack of MED, then you build up the oxidative glutathione, and that will block the entry of the electron donors. One of the reasons that the keto diet works very well is it tends to use a different pathway and puts the electron donors in a complex 2 and actually creates more ATP per mole of whatever. In that membrane, okay, the inner mitochondrial membrane especially, if you have a leaky gut, then you have leaky cells, leaky brain, okay? The name of the book I wrote on Amazon, shameless plug, okay?
Well, give us that shameless plot. Tell us,
Yeah,
our listeners,
what it's about. You want to share that.
That's the name of my book, leaky gut, leaky cells, leaky brain, okay? And it's more cost effective if you get it on Kindle. But I spent with a very wonderful practitioner in Australia. He wrote this book several years ago to make that whole process understandable. And I think we accomplished it. Everybody gave me lots of compliments on the book. Nevertheless, that membrane, if you have leaky gut and leaky cells because of all this damage that's occurred, that's going to be leaky. So all those high energy protons want to come out. So instead of ATP synthase doing this, you're not getting as much ATP. Why foundational food? Because you're treating all these different parameters, even though it may seem like you're shotgunning. The fact is, you know that with a lot of oxidative stress, you need those vitamins and minerals in the cell. You need the phospholipids for the cell membranes, okay? And you need to be able to buffer, make the system more alkaline, which is done with buffers or minerals, okay? It's not rocket science, which is why at first it was, Jess, that's too simple. That can't be it. I'm like, should I put a fancy name on it just to make you guys happy? Okay. And I would say, oh, I do that. Oh, really? What are you doing? I give my patients probiotics. Thank you. That doesn't treat leaky gut by itself. Okay. I give my patients multivitamin. Really? One from the local pharmacy? The one that never gets a door? Okay. In other words, you're not thinking. Okay. And that annoys the heck out of me, by the way. People who follow protocols as if the protocols were an end unto themselves. Protocols are jumping off points. They're not shortcuts. They're jumping off points. And there are guys out there that practice protocols. I practice this protocol. Really? Okay. What happens when they call you up and say it's not working? I'll just keep taking it. It'll work eventually. And then all of a sudden they sulk away. They usually meet me in the dark alley. Hi. I heard you're treating protocols. Let's have a conversation. I mean, I teach, I teach other practitioners. I lecture all over the world, and I make it funny, but I get giving the impression, guys, I want you to start thinking again. I'm trying to recreate the GPs. Specialists are great, but when you have a little specialists, the onus of diagnosis is on the person least trained to do it, and that's the patient themselves. They're the ones that have to figure out if they have a belly pain, whether they should go to a gynecologist, a gastroenterologist, or whatever. Okay, that's not their job. That's our job. That's what all those years of school are about. But specialists, you should be referring to them. You don't go to a gynecologist and say, can you fix my knee? Okay. You don't go to an orthopedic surgeon and expect internal medicine. Okay. This should be the area that a GP or a good family doctor coordinates. And this is very much like when I was a nurse. Okay. I coordinated everything when I was a nurse. Okay. That's what nurses do best. And they're the patient advocates, a lot of nurses. The old saying that, nurses make sure doctors don't kill you. And it happens to be true. It really is.
Yeah.
So your question was, all right, so and mitochondrial function is not to be thought of by itself. Okay, the end result of fixing the pathways is good mitochondrial function. And when your mitochondria start functioning well, you're producing more ATP, which gives you the ability to heal because everything requires energy. Okay, in order to do that, you have to make sure you're digesting your food. Okay, you have to make sure you don't have leaky gut. Okay, and you have to make sure that the cells need what they need to work. I'm going to give you a simple program that anybody can use as a base. Doesn't work with everything, but it's usually a good base. And this is the beginning of what I call foundational training. I talked about the cells needing, the biochemical process needing vitamins and minerals, which are often called cofactors. Okay. The problem is absorption. Okay. The hierarchy of absorption: intravenous, liposomal, liquid, powders, capsules, tablets. You go to your local pharmacy and get multivitamin tablets of the old wanted days. They don't get absorbed. If you have any kind of gut problem, they're not going to absorb. Okay. You only need to get a little of it, not enough that your body needs. You need to have an absorbable vitamin and mineral. And these days, that's not hard to do. Look for the word liposomal. IV is too expensive. And okay, we're talking expensive. Liposomal vitamins are on the market pretty well. And they have ones in capsules now that are powdered. The dry liposome process, I knew the guy who invented it. Okay, he worked with Nutrition International. And when that was created, nobody had a formula. Now it's been promulgated. Okay, it works. It gets directly into the cells through the mucous membranes, regardless of how bad your gut is. Okay, so you can give your cell what they need. Because if you take a regular multivitamin, what happens? It goes in the stomach. Let's say it does get absorbed. Well, if it gets absorbed, it has to go through the liver circulation a couple times. Then gets released into circulation. Then it's got to go across those membranes into the cells. Okay, kind of a difficult thing, because that's why people don't get what they need. And frankly, they're not getting it from their foods. Two reasons, because even if you're eating organic, once it's just pulled out of the ground, it starts losing nutritive value over time. And of course, these days, if you get a tomato in the winter, it came from, let's say, Chile 3 months ago. It's not vine ripened tomatoes. Okay? So your digestion, if it's faulty at all, okay, you're not going to get the maximum effect from your foods. Okay? Always, you never wrong by taking notes. And what's the best kind of minerals to take? Well, look at the humic and folic acid minerals, things like, if I'm pronouncing it right, shalgit, anyway, the Himalayan thing, okay? You can get those in liquid or just the resin, which you put in a little bit of tea and do that a few times a day, and inundate yourself with minerals. Because we live in a mineral deficient society, and that's usually the reason why you're not getting it into your cells. Okay? So that will get your biochemical processes working the way it's supposed to. Now, digestive enzymes, okay, to break down your foods the way they're supposed to. Okay, the emulsant herbs, things like slippery elm and so forth, that will create a mucus layer. Things like butyrate that can help the cells heal, and a general probiotic, which is usually lactobacillus and bacteria. That's a basic program. Okay. Also, if you can add into that things like sunflower lecithin, going to give the cells what they need to work. So that little basic program will at least start your body on the way to go. Okay, that's giving your body what it needs to work. Is there more that has to be done? Absolutely. Okay, it depends on what the issues are downstream, but you got to start there.
Yeah, I was going to say, that sounds like a really doable starting point. I have heard of all of those things you mentioned, but it's not uncommon for us who have researched to hear of those things. Thank you for giving us just the kind of a little snapshot of, hey, this is a place you can start. Do you go more into depth in this in your book, I assume?
Yeah. Actually, there's a lot of different formulations in there you can use. I'd like to update it, but it's a kind of a Herculean task. But no, we spent a lot of time putting that together, and even putting different product names from the United States and Australia. Okay, that can be utilized.
Awesome. Well, if our listeners want to get in touch with you, or if they want to follow you, where is the best way, or what is the best way for them to find you?
Well, if you take my name, Dr. Jess Armine, just put together, and go to drjessarmine.com, okay, you can see, if you're having, most autoimmune problems are very complex. Okay, so if you want to know if I can help you, all you do is go there. There's a button you can press that will allow you to schedule it for a free 30-minute session, which what we'll do is we'll go over your condition, and this way I can determine if I can help you or not, and we can feel together whether we'll look at it. Okay, and that's no obligation. I am not a predatory kind of guy. I'm not a pressureful person. I tend to talk a little much, but what can I say? It's me. Okay. That's the best way to get in touch with me. If you have questions, you just put Jess, my first name, at drjessarmine.com. You can send me an email.
Beautiful.
Well, we are so happy you came and shared your time and your experience and wisdom with us today. Conversations like this are incredibly important because so many people living with chronic illness are just confused and they don't even know where to begin. So thank you for giving us hope. And we will definitely be bringing you back.
Please,
because we enjoy being you here to talk with us. So we will definitely bring you back again in the future. And to our followers, we thank you for joining us on Autoimmune Adventures. Remember, you are worthy of joy. Disease does not define your life. You do.